So let's move forward. The next speaker is Hafiz Aziz, who will be presenting data from the ASAP-ECMO study on antibiotic, but also analgesic and sedative agents in ECMO patients. Please.
Thanks, Jan. I'm Hafiz. So today I will be talking about the findings of ASAP-ECMO. So ECMO is extracorporeal membrane oxygenation. It's a life support device or a machine that we provide to patients with cardiorespiratory failure who fail maximal medical management. So basically you can think ECMO as your artificial lung or heart that supply oxygen while the clinicians try to understand the condition of patients and think about what to do next for the patients. So ECMO is a life support device, and it does not modify the disease. So what's really important for this patient is optimal therapy that we provide to these patients for them to ensure successful liberation from the machine. Drugs such as antibiotics or sedatives are important for this patient, and it's really important for us to ensure that we provide optimal dosing for these patients, but it is not straightforward because the machines, as you can see, the oxygenator, the conduit tubings, the pump can sequester or can eat up the drugs that we provide to these patients, reducing the effective concentrations that are needed to be optimal for these patients. And we have limited dosing guidance to use for these patients. So with that in mind, under the leadership of Associate Professor Kiran Shekhar and also Professor Jason Roberts, we undertook the ASAP-ECMO study, which stands for Antibiotic, Sedative and Analgesic Pharmacokinetics during ECMO. So it was a prospective open-label multi-center PK study across Australia, New Zealand, South Korea and Switzerland. We recruited critically ill adult patients receiving ECMO with an aim to describe the PK of common antibiotics and also sedatives during ECMO, to evaluate the adequacy of current antibiotic dosing for these patients. And with the data available, we aim to also generate optimal dosing recommendations for these patients. So these are the antibiotics that we collected, and this study was performed from 2012. So Prince Charles, St. Vincent, Auckland, and Alfred were the pioneering sites. And then in 2018, Bern and Seoul came in and to further increase the number of patients. So as you can see, the top 3 antibiotics that we have data for is meropenem, piptaz, and also vancomycin. So I'm just going to highlight the main findings of the ASAP-ECMO study. So this is the main paper of ASAP-ECMO. So this essentially are individual plasma concentration time points for those antimicrobials, and as you can see, the concentrations were really variable. So the variability in PK parameters for these antimicrobials were reported as more than 30%. And it's interesting that when these patients received concomitant renal replacement therapy or dialysis, the variability increased more than 40%. We also aim to assess the dosing adequacy in these patients. So this is the results of the concentrations based on whether the patients achieve the target concentrations or not. So as you can see, so the gray shaded area is what we wanted the concentrations to be in, which is the therapeutic range. So this range is the range that we have found that patients will likely demonstrate positive outcomes in critically ill patients. So 2 out of 5 patients did not achieve the target concentration exposures in the ASAP-ECMO study. So if we remember the DALI study and also the SMART study, this is actually the same or similar to those 2 studies. And what's more interesting, the most common drugs that are being used for these patients, piperacillin, vancomycin. So these are where the patients were described to be demonstrating subtherapeutic exposures. So we are not really dosing these patients correctly. So suboptimal dosing is common in the ICU, as previously shown by the 2 studies, the DALI and SMART studies. So we need a different approach to dose these patients. And on top of that, we also publish individual papers to generate dosing recommendations when patients were receiving ECMO. We have individual papers for piperacillin, tazobactam, vancomycin, cefepime, ceftriaxone, what's this? Ciprofloxacin, and also the latest one is fluconazole. So the next steps are we are going to analyze meropenem, oseltamivir, and we are going to proceed with sedatives and analgesics. And some of the data of previous studies have been included in resources such as UpToDate and also the ESICM airspace dosing tool. I think with that, I would like to acknowledge the team members and also Dr. Chang, who was the PhD student on the project, and also Dr. Steve Wallace, who led the bioanalysis for all drugs. But, thank you.
Wonderful. Also, again, a lot of information, a lot of data there, and a nice example of how this project also informs the guidelines.